So I'm Ms. Fraser and I'm a GP in Canberra, and I'll start with some disclosures. I make a living as a GP and I practice low carbohydrate medicine. I really like de-prescribing and I talk much more than I prescribe. I've also been paid modest honorariums for articles published by Australian Doctor magazine, and this is one that Ron and I co-authored. And for the effort involved, it's so not about the money. Together with Tracy Kimberley, I co-convened Low Carb Canberra, and we manage a private Facebook group and a public page. And we've organised a couple of events, and Low Carb Canberra 2019 and 2020. And we've made a little bit of money which we put towards further building the low carb community in our region. So today's talk is called Misinformation, and really it's the ology of misinformation. I'm going to talk about the myths about low carb very briefly, but I'm more interested in the process of myth making. How do the myths get into our heads, and what can we do, and what are we doing? And there's lots of people in this room who are already doing quite a lot to counter the misinformation. And this is also a bit about my journey as a low carb advocate. I've been right into this since I went to Low Carb Down Under in Sydney in May 2018, and I heard doctors like Paul Mason and Dr. Doran Sher talk about the science, and it was like I was sold. So as a GP, I spend a lot of time talking with patients about the misinformation in their heads. And I think the myths function as barriers to people implementing low carb. And we've heard from Mary and Lucy this morning about the work that they do with people who've got those stories in their heads. So there's lots of stories out there. The protein will wreck your kidneys, the meat causes cancer. And the myths are also in doctors' heads, and it doesn't help when a patient is trying to do low carb and they go to their doctor and the doctor says the low carb's going to kill you. So last year I started writing an article responding to the critics of low carb, and there's lots of criticisms and I'm sure you'll be familiar with them. And for example, there's the cholesterol will kill you myth, or the more sophisticated version that saturated fat will kill you. And we could spend hours talking about those ideas and why they're wrong, and some very smart people have already done those talks, and you can find them in Low Carb Down Under video library. I didn't finish the article. I basically got bogged down in the detail, and there's some of the detail. I did make up this table which summarised the main criticisms and the counter arguments, and this is actually only a bit of the table. I couldn't fit everything on the slide. But a couple of examples of the myths. Low carb is unsustainable, and I think, well, compared to what? Packaged ultra-processed food-like substances, or this epidemic that of metabolic disease that's bankrupting the health system, which Dr. Bruckner talked about. There's the myth of fibre. Without fibre you'll die, or at least your microbiome will die. And where I got to with that is if low carb can be low fibre, zero fibre, low fibre or high fibre, does fibre matter? And I think, yes, if you're eating a SAD diet, an SAD diet, fibre probably does matter. But Dr. Paul Mason and people like Zoe Harcombe have done very good talks on the myth of fibre. Links in with this idea that vegetables and salad are healthy. Many people are convinced that they have to eat vegetables and salad to be healthy and lose weight. And if you put in salad and health into Google, this is pretty much what you come up with, lots of pretty pictures. And I've certainly been a veggie tragic for a lot of my life, and I have been coming around to this idea that perhaps I don't need as many vegetables as I used to think I needed. There's the fad myth diet. Look, let's skip that one. The keto is the worst diet ever for a whole range of reasons, and we can thank Belinda Fettke for exposing the really sordid history of the influence of plant-based religious zealotry on dietitian organisations and how the corruption of dietary guidelines in the US and here and around the world. The myth about meat. A lot of people are convinced, this is what I hear in general practice, oh, I'm trying to cut down meat because it causes cancer and it's ruining the planet. And then that'll start the next 10 minutes of conversation about why that's not true. So I really see patients struggling with these myths, and I think it slows down their progress. And these myths are out there in the popular media. So what I really want to do today is shift focus a bit and look at how these myths get stuck inside our heads. And so look a bit at the role of the media and what we can do within the low carb community to expose the myth information. I'm not going to cover Belinda Fettke's excellent work. Suffice to say that there are vested interests at work. What I'm going to look at is how they're sort of working. And I'm drawing here on the work of a fellow on Twitter, at the University of Twitter, a guy called John Zahorik, and he uses this diagram and he talks about owned media, the people who call the shots, the people who've got the money, big food and big pharma, the paid media, the earned media and social platforms that all have a role in exposing us to myth information about low carb and perpetuating the myths. Now, I'm going to give an example here, and I'm sorry to mention this phrase, but who here has heard of keto crotch?
Yes.
Yeah, so some people have. I don't want to give it oxygen, it's an awful thing, but it's a really good example of myth making, and if you draw, expose the process to the light, you can understand how the myths get made, and perhaps it might help us undo it. So in a series of tweets, Zahorik traces the sudden appearance of this myth. And that's his list of 31 media articles which were published between February 25 and March 3 in 2019. So in the space of less than 2 weeks, 31 articles published in various magazines, and so it was an orchestrated media campaign which set off a social media storm which was free publicity, and there was a series of rebuttals. For example, our beloved Dr. Ken Berry made a video on the 2nd of March 2019 which provided a rebuttal. But the problem with rebuttals is that it risks giving crap more adherence. It just makes it more sticky. So here is Zahorik's cloverleaf analysis of that phenomenon, and he points out that the owned media, it wasn't obvious who initiated the campaign. Zahorik's analysis sees the hand of big food funding the PR campaign, the HuffPost and the Forbes and the Women's Health and the Daily Mail and the paid content, setting off the social media storm on Twitter and Facebook and Dr. Berry's YouTube and other rebuttals. So bearing in mind that there was absolutely no science behind this, all of that perpetuated a phenomenon that had no basis in reality. I guess it's an example of shameless manipulation. The campaign originates at a very high level. It's deliberate myth-making. Large organisations have PR teams working hard at influencing public opinion, and it's analogous to a political campaign. Influencing mindset, and we had Lucy and Mary talking about mindset and how hard you guys have to work to reverse that mindset. It's influencing people's purchasing decisions, food and eating behaviours. So it's permeating down into really ordinary everyday life, the stuff that we do every day. We should not underestimate the power and the influence of vested interests, both at government level and also in corporations. And just a mention of corporations, I'm sure many of you have seen this slide It's just a who's who of who controls the media and, well, who pays the media. I guess it's about who pays the piper calls the tune. Who controls the narrative? Well, Kraft, Coca-Cola, Kellogg's, Mars, Johnson & Johnson, Nestle, etc. And if you read the Zohoric tweet, it's a Twitter thread, he actually names some names, Big Food and the PR companies that he thinks helped orchestrate the campaign. So how making myths stick? Often the marketers are using keywords and concepts and catchy mnemonics, which are memorable. They produce provocative headlines. They use repetition. Again, I think you guys have talked about, or we've heard this morning about how repetition is important. Just mere exposure is a concept that comes from marketing. These ideas get in on a subliminal level. Zohoric mentions that marketers program us to associate more complex talking points with easily remembered words and images. So, for example, dietitians can use key phrases like fibre, and breakfast is the most important meal of the day, and everything in moderation, and we all know what it means. So, yes, read the Zohoric thread for a primer on this, and basically what he says is follow the money, and he's done that work. This is another example, my second example of myth making, and it's the egg study that came out last year. And it was the one that claims that eggs are associated with diabetes. Now, this is a bit different to the previous example. It's more insidious, it's less blatant. It looks like science because there is a study. And the study was published in October 2020 in the British Journal of Nutrition. And the main author is affiliated with the University of South Australia in Adelaide. So it got quite a lot of publicity here in Australia, as well as internationally. The data collection was in fact in a Chinese population. And the bit that I've highlighted down below says, results suggest that higher egg consumption was positively associated with the risk of diabetes in Chinese adults. Now you can imagine the headlines that translated into. Instead of a small association, it became causation. And this is how it works. There were 73 news stories from 61 outlets in a space of about 7 weeks between mid-November and early January this year. Was there a silent-owned media promoting this? I actually don't know. I haven't done that degree of delving down. But it is pertinent to make a comment about the concentration of media ownership in this country and elsewhere. It helps determine what gets airtime and what doesn't. So how many low-carb studies actually get airtime? I heard about the egg study from Low Carb Canberra Facebook on November 14 when a member posted one of the media articles, and there was a bit of flurry of activity. By November 23, Zoe Harcombe had published her rebuttal and showed that it was based in the mythology of nutritional epidemiology. So association, not causation, tiny, like weeny tiny effect sizes, large confounders. The association only applied to women. If you looked in the fine print, the association only applied to women, and the biggest confounder was the sugar in the flour being eaten alongside with the egg. But of course, in a few weeks, inside of 7 weeks, it had travelled far, and what people will remember is the headline. So it's a really good example of misinformation making. And so when patients come into a low-carb doctor and the low-carb doctor says, instead of muesli or porridge for breakfast, how about you have some eggs? They'll exclaim, but doctor, you're going to give me diabetes. That's what people will remember. So this is the problem. A lie gets halfway around the world before truth has a chance to get its pants on. So what can we do? And I guess this last part of this talk is really about what are we already doing? And not everyone in this room will be doing all of this, but many of you are doing a lot. I think in the low carb community, I actually think we're amateurs in terms of marketing and influencing. We're up against it. We're not backed by big money. There's little profit in real food. We're not highly organised like the corporations. Marketing health behaviour is actually much harder than marketing junk food. I think we're minnows up against a juggernaut. But we are already engaged in the diet wars. And so here are some strategies. I've had a lot of help. I have a friend who I've met for the first time today who's had type 1 diabetes for most of his life and been low carb for 20 plus years and doing advocacy in that time, and I've learnt some things from him. I also have a social media mentor, so someone who helps me deal with Twitter and Facebook and points out that influencing can be a full-time job. It's really important work. And these people have helped me become more aware of what I'm doing and why, and to help spread the message. So one of the strategies, I think, is reframing, and this comes from the US linguist George Lakoff, and he wrote a book called Don't Think of an Elephant, and if you've ever read it, it's actually all about US politics. But I think there are some key concepts that we can get from Lakoff. And the first one is, when you're arguing with the other side, don't use their language. It only reinforces their frame. So the frame is the big picture. And we need to develop our own frames, which are our values, clear values and vision. And one of these frames is real food, because this links with ideas about satiety and nutritious food and liberated eating, not being beholden to cravings. And some of us are already doing this, and I'm doing shout outs to Dr. Bruckner, his Fat Lot of Good, you're familiar with this hopefully, and also to Mary and Lucy for a great example of framing real food, real life, real people, real medicine. There's your frame, the rest follows. Fabulous. For doctors, the science. This is evidence-based. As doctors, we need to be familiar with the studies, we need to know the numbers, we need to be prepared to debate the science with our colleagues and peers. We need to use this knowledge to talk with our patients. And some of our low-carb thought leaders are actually really, really good at doing this. And for example, here's the paper from Dr. Unwin about reversing diabetes. But as Dr. Fetke can tell us, science alone is not enough. It's an important start, but it's not enough. Something that I learned from my friend Ron Raab, use humour. People, I think Lucy and Mary are also very good at this. People new to the low carb have a lot to contend with. There's a hostile food environment with ultra-processed foods and carbs at every turn. They're trying to change their long-term dietary habits. There's a hostile food culture. You might be the only person at the office morning tea not eating cake. So people in the community, patients and all of us need snappy comebacks, and Lucy's had some terrific snappy comebacks today. I wish I could memorise all these things and have them on tap. Dr. Pran's memes just make fun of the bull crap. And I collect images, and there's really no shortage of hilarious images out there. That's one of my favourites. Spread positive messages. There are a lot of positive messages out there. I love that. Like I said, I like deprescribing. Use social media. It's a tool. The vested interests that we oppose in the so-called diet wars use social media very effectively. We can use it effectively too. There is an illustration from Dr. Roth, who's somebody that I follow on Twitter, and he's collecting exhibits as they appear on social media. Dr. Unwin is also really good at using Twitter to spread positive messages. And remember again that concept of mere exposure. Just by putting these things out there, using the keto and low carb words with positive images like this, spreads the message, and they will get in at some level, even if subliminally. And if one day someone out there just thinks, oh yeah, keto can help, then that's important. Be noisy with people like Belinda and Gary Fettke and the other low carb opinion leaders. Be prepared to argue the case with patients, colleagues, with the specialists. We have to be repetitious. We have to say the same thing over and over again because, again, I think as Lucy or Mary pointed out, those messages promoting high carb, low fat, we've been exposed to them for decades, day in, day out. We need to be repetitive and say the same things over and over, spread the memes. Push for change. This is my version of the Australian Dietary Guidelines. There's a song that goes with it. The guidelines are in a review process at the moment. If you can, get involved. My superpower is writing. So in my spare time, I put on my World Changers cape, I stoke up my laptop, and I reach out to other doctors through the medical media. And I personally think it's incredibly important to try and influence my medical colleagues. So this is an opinion piece that got published. I co-authored with Dr. James Mukey, and it got published in Australian Doctor in February of this year. It potentially reached thousands of Australian doctors. I don't know whether it will make a difference, but at least we're trying to put ourselves out there. I co-convene Low Carb Canberra. We're approaching 700 members. I think I can reach more people through Facebook than I can by talking with individual patients. And I see my role as a GP is very much about interpreting the science for those people. And I think GPs are in a very interesting position. I think there is a revolution from below, the patients who are coming to the doctors. And GPs are this intermediate position, I guess, between patients and specialists and researchers. So I think reaching GPs is something that's very important for me. Low Carb Canberra, we put on conferences and education events. We share our successes. We help build community. I'm talking to patients. I try and help them understand the myths, as Lucy and Mary are doing, and slowly change their understanding and behaviour. And I think we need to be repetitive and sometimes quite provocative, because as a community we have a very big job to do to get the ship unstuck and to turn it around. But I think it is possible. So I'm going to finish with coming back to the myth. And there's this lovely little story about the lie and the truth having a bath together, and the lie leapt out of the water, fled wearing the clothes of truth. The truth, furious, climbed out of the well to get her clothes back, but the world, upon seeing naked truth, looked away, because the world has no desire to know the naked truth. And at this point, I'm actually finished, and I hand back to Rod, and hope this will lead into some further discussion of what could be a really enormous topic. Medicines a day, 6 medicines a day, 6 medicines a day, 60 teaspoons of sugar and 6 medicines a day, exactly as the guidelines say.